It's something so familiar, isn't it? A spot, a patch, a mark on the skin that's been there since the very beginning, or maybe showed up just weeks after birth. Most of us know someone with one, or maybe you're listening right now and you have one yourself. We call them birthmarks, and on the surface they seem pretty simple, just marks. But what are they really? Where do they come from? And is there ever a deeper story behind that mark?
What's truly fascinating when you start looking closely is how something that seems purely surface level, purely cosmetic even, can actually open up a whole world of medical understanding, genetic connections, and yeah, significant human experiences.
Absolutely. And that's exactly the kind of journey we love to take here on the Deep Dive. Today, we are peeling back those layers, taking an in-depth look at birthmarks, those distinctive spots or patches on your skin that you either arrive with or that appear shortly after birth.
And for this deep dive, we haven't just glanced at the topic. We've really dug into a solid stack of sources. We've pulled insights from highly trusted medical resources like Cleveland Clinic, Healthline, Nemours Kids Health, Medical News Today.
Yeah, the big names.
Right. Then gone deeper into academic material from NCBI, Bookshelf, specifically stat pearls, and research articles found via PubMed Central, PMC. So a good mix.
That's our toolkit for today.
Oh.
Our mission in this deep dive is to extract the most important nuggets of knowledge from all this material, helping you become truly well-informed about birthmarks. We're going to explore the surprising variety of types, understand what the experts believe causes them, how they're evaluated when there's a concern.
The treatment options available.
Right. And perhaps most crucially, what living with a birthmark can entail the very real human side of the story.
The initial overview from this body of sources confirms what many might suspect. Birthmarks are incredibly common. They appear in a remarkable range of shapes, sizes, and colors, and they primarily fall into two major categories. Those involving blood vessels, so vascular, and those involving pigment cells, the pigmented ones. For the most part, the sources agree they are harmless and don't cause pain. Often they are purely cosmetic. But, and this is a crucial point our sources emphasize, sometimes changes in a birthmark or the presence of certain specific types can be a sign of something deeper, something that definitely needs medical attention.
Okay, that sets the stage nicely. Let's unpack this by starting with those two main categories the sources highlight.
Yeah, think of these as the two fundamental ways birthmarks show up on the skin based on which type of cell didn't quite develop as expected in that specific area.
So first up, we have vascular birthmarks.
Yeah.
These are the ones typically associated with shades of red, pink, purple, or even bluish hues, right?
Yes, exactly. And the sources consistently explain that the reason for this coloration is that these marks are essentially made up of blood vessels, tiny capillaries, or larger ones that didn't form or cluster in the typical way during fetal development. Their color comes directly from the blood circulating within these visible vessels in or just under the skin.
And they have different timelines for showing up. Some are there at birth, but others appear a bit later.
Precisely. Many vascular birthmarks are indeed present when a baby is born, but some, notably the very common strawberry type, might only make their appearance a few weeks after birth. Our sources detail several specific types within this vascular family that are important to understand.
Well, let's start with that common one then. The strawberry haemangioma, also known as a superficial hemangioma.
Ah, yes, the strawberry mark. It gets its name because it often looks like the surface of a strawberry bright red with a slightly raised, sometimes bumpy texture. The sources describe them as being formed by a dense collection of small, closely packed blood vessels.
And they can pop up anywhere, but the sources say there are common locations.
Yes, they can technically appear anywhere on the body, but they're most frequently seen on the face, the scalp, the back, or the chest. And as you mentioned, they often aren't there on day one. They might show up several weeks after birth.
What's fascinating about these, according to the sources, is their life cycle. They don't just stay the same size, do they?
No, they have a very predictable and often quite dramatic natural history. They usually go through a phase of rapid growth called the proliferative phase, typically during the first year of life.
Okay.
Then they hit a plateau, staying a fixed size for a while before entering the involution phase, where they start to shrink and fade.
And for many, they actually disappear entirely, which must be a relief for parents sometimes.
That's right. The sources note that most strawberry hemangiomas are completely gone by about age 9, though the process can start much earlier. Sometimes, even after they fade, a slight discoloration or maybe a bit of skin puckering might remain in the area where the hemangioma was, just a little reminder it was there.
And just how frequent are these? The sources provide a staggering statistic.
It is pretty amazing, isn't it? An estimated 10% of all babies worldwide have a hemangioma of some kind.
10%. That makes them incredibly common features of infancy.
That's a huge number, highlighting how normal they are for many families. Now, related to the strawberry type are cavernous hemangiomas.
These sound like they're deeper, based on the name.
They are. The sources explain they are similar in principle to superficial hemangiomas, but extend further down below the skin surface into deeper tissues.
What do they look like if they're deeper? Can you still see them clearly?
Their appearance can be a bit different, often a red to bluish, sometimes lumpy or spongy mass of tissue, because they contain larger blood-filled spaces. Like the superficial ones, the sources mention that some of these deeper lesions can also disappear on their own as the child gets older, usually by the time they approach school age.
Okay, next we have perhaps the most poetically named vascular birthmarks. Salmon patches, also affectionately known as stork bites, or angel kisses. Lovely names.
They are lovely names, and these are arguably the most common vascular birthmark found in newborns. The sources are clear on their frequency, stating they appear on a massive percentage of babies, between 30% and 50% of newborns in the U.S. alone.
Wow, nearly half of all babies born might have one of these. What do they look like? Are they obvious?
They're described as very faint red or pink marks. The color comes from tiny blood vessels, capillaries, that are visible through the delicate skin. They often look like a flat flush rather than a raised mark, so sometimes quite subtle.
And the names give away their most common locations, right? Angel kisses and stork bites.
Exactly. Angel kisses are typically found on the face, on the forehead, eyelids, upper lip, or right between the eyebrows. The idea being that an angel kissed the baby there. Stork bites are located on the back of the neck, supposedly where the stork carried the baby.
Charming. And the good news is, like the strawberry marks, these tend to fade as well.
Yes, they usually become much less noticeable or disappear entirely as a child grows and their skin thickens. The ones on the back of the neck, the stork bites, may be permanent, but they are often easily covered by hair and not very noticeable.
Oh, okay.
The sources also add a detail that parents often observe. These marks can become more prominent or noticeable when the baby is crying or gets warm because blood flow increases to the area.
Right, I've heard parents mention that. So, highly common and usually harmless marks that often fade. Now let's move to a type that's generally permanent. Port wine stain birthmarks.
Yes, these are quite distinct from the fading marks. The sources describe them as flat patches, ranging in color from purple to deep red, often looking like wine has been spilled on the skin. Like salmon patches, they are made of dilated blood capillaries, but unlike salmon patches, these vessels are larger and remain dilated, making the mark permanent unless treated.
And where do they typically appear?
They occur most often on the face, which can make them particularly impactful, but they can also be found on other areas like the neck, arms, or legs.
And they change over time, too, not just stay the same shade.
That's right. The sources point out that these marks don't just stay the same throughout life. They can thicken or darken over time if they're not treated.
I think I read in the sources that they can even change texture.
Yes. One source notes that by middle adulthood, if untreated, the thickened areas within the port wine stain can sometimes feel like small pebbles under the skin. The marks themselves only grow in size proportionally as the child grows. They don't expand rapidly like some hemangiomas do.
That permanence, especially in a very visible location like the face, can carry a significant emotional weight. The sources acknowledge that this can cause self-esteem concerns for individuals.
Absolutely. And this is where the medical relevance deepens beyond just appearance. The sources make it clear that while most port wine stains are isolated findings, just the mark itself, they can sometimes occur in association with other medical conditions.
Like Sturge-Weber syndrome or Klippel-Trenaunay syndrome, those names came up.
Precisely. If a port wine stain is in certain locations, particularly involving the eyelid or forehead, it can be a sign that a child might have Sturge-Weber syndrome, which involves abnormalities in the blood vessels of the brain and eye. It can lead to seizures or glaucoma. Klippel-Trenaunay syndrome, often associated with port wine stains on a limb, involves issues with blood vessels, bone, and soft tissue overgrowth in that limb. The sources emphasize that if these associated syndromes are suspected, regular medical evaluation is absolutely essential to monitor for potential complications.
So what seems like just a skin mark can sometimes be a critical piece of a larger medical picture, a visible clue.
Exactly. The birthmark acts as a visible signal for doctors to look deeper.
The sources also introduce a distinction within the hemangioma group that sounds important for diagnosis. The difference between infantile hemangiomas and congenital hemangiomas. It seems to come down to when they show up and how they grow.
This is a key classification in the medical community, yes. It predicts the mark's natural history and helps guide treatment decisions. Infantile hemangiomas are what we commonly think of as the strawberry marks, as the sources noted. They are typically not present at birth. They appear after birth, usually within the first few weeks or months,
Right.
and then go through that characteristic growth phase, proliferation, before shrinking, involution.
Right. They're the ones that grow and then tend to resolve. Got it.
In contrast, congenital hemangiomas are fully formed and present at birth. The sources explain that these lesions appear to have already completed their growth phase while the baby was still developing in the uterus.
So they're already done growing when the baby arrives.
Pretty much. And within this congenital category, our sources highlight two main types, differentiated by whether they shrink or not after birth.
Okay, what are they? First, the rapidly involuting congenital hemangioma, or RICH.
Yes. These are present at birth, and, as the name rapidly involuting suggests, they shrink significantly and quickly after birth. This involution phase typically happens within the first year of life, often completed by about 14 months.
And what do they look like at birth?
Their appearance can be quite varied. They might be purple with visible veins radiating out, or pink with firm nodules, or a rounded shape with a pale ring around them and tiny visible blood vessels. Quite distinct appearances are possible.
And the sources mention that even though they shrink, they can sometimes cause problems. They're not always straightforward.
They can. Potential complications during the involution phase or even afterwards include ulceration, where the surface breaks down, bleeding, and tissue necrosis, which is tissue death in some areas. And even after they resolve, the sources note they can sometimes leave behind areas of skin atrophy, which is a thinning or indentation of the skin.
Okay. Then there's the one that doesn't shrink, the non-involuting congenital hemangioma, or NICH.
Also present at birth, but these, unlike RACH, do not spontaneously regress or disappear.
So they're permanent, like a port wine stain, but a different type of structure?
Yes, they're permanent in that they don't shrink away. They grow proportionally with the child, maintaining their size relative to the child's overall growth. Their appearance is usually flatter than a RICH, with sharper, well-defined edges. They can feel firm or slightly raised, and range in color from purple to even skin-colored, often with superficial telangiectasia, those tiny visible blood vessels, and sometimes a pale rim.
And the sources note a specific medical detail that helps doctors tell rich NICH apart from most infantile hemangiomas. Something about a marker.
They do. It's a cellular marker called GLUT1. It's a protein involved in glucose transport. Most infantile hemangiomas test positive for GLUT1, while rich GH and NICH are typically GLUT1 negative.
Okay.
This difference at the cellular level is a key diagnostic point for clinicians and suggests different underlying biological mechanisms for their formation and behavior, even though they're all essentially abnormal blood vessel growths.
That technical distinction really shows the depth of research behind these marks. The sources also provide some other general but crucial details about hemangiomas.
Like their most common locations and their potential functional impact. As noted earlier, the head and neck are the most frequent sites for hemangiomas. And critically, regardless of type, hemangiomas can cause significant problems if their sheer size or location interferes with vital bodily functions.
You mean like if they block vision or make it hard to breathe?
Exactly, that's the major concern. Rapidly growing hemangiomas in specific locations like near the eye, potentially obstructing sight, or on the lip or inside the mouth, affecting feeding, or near the airway in the neck or throat, impacting breathing. These require urgent medical attention because they can quickly cause functional impairment, especially in infants.
And the sources indicate that certain patterns of hemangiomas, or having many of them, can signal issues beyond the skin.
This is another major clinical aha from the sources. They point out that segmental hemangiomas, which means they follow patterns along specific parts of the body associated with embryonic development, are more strongly associated with anomalies occurring outside the skin, in internal organs or systems.
Okay, segmental implies a pattern.
Right. And this pattern can indicate issues like spinal dysraphism, problems with spinal cord development, genitourinary abnormalities, issues with the urinary and reproductive systems, and most significantly, PACE syndrome.
PKCE syndrome, that's an acronym we saw in the sources. Sounds serious.
It is, and it's a critical one to recognize. The sources spell out what it stands for. Posterior fossa malformations, abnormalities in the lower back part of the brain. Hemangiomas, often large segmental ones, typically on the face. Arterial anomalies, problems with the large blood vessels, especially in the head and neck. Coarctation of the aorta or other cardiac defects, heart problems, and eye abnormalities.
So finding a large, unusually shaped hemangioma, especially on the face or neck, should make doctors think about FAC syndrome and order tests to check for these internal issues, like a brain scan or heart check.
Precisely. It's a vital connection for early diagnosis and management of these potentially complex conditions. The sources also highlight the significance of multiple hemangiomas, also known as diffuse neonatal hemangiomatosis. If a baby has more than 5 hemangiomas visible on the skin.
More than 5, that's the threshold.
Yes, that's the number mentioned. If a child has more than 5 lesions, screening is recommended for internal involvement.
Screening. Why is that needed just because there are more spots? What's the risk?
Because having multiple skin hemangiomas is strongly associated with a higher risk of also having hemangiomas inside the body in organs like the liver, lungs, eyes, the central nervous system, or the lining of the mouth.
That sounds quite serious. Internal hemangiomas.
It can be. The potential complications listed by the sources are severe and can be life-threatening. High output cardiac failure, essentially the heart working too hard to pump blood through all the extra vessels in the hemangiomas.
Wow.
Hydrocephalus, fluid buildup in the brain. If there are CNS lesions, ocular abnormalities potentially leading to vision loss, visceral hemorrhage, internal bleeding, and even thyroid abnormalities like hypothyroidism. The sources unfortunately note that mortality can be high in very complex cases with extensive internal hemangiomas.
Wow. Okay. So while many vascular birthmarks are truly just those fading angel kisses or resolving strawberry marks, understanding these more complex types, their different growth patterns, and their potential links to systemic issues is absolutely critical for medical professionals and parents alike. It's not always just skin deep.
That comprehensive view is exactly what the sources provide on the vascular side. Now, let's shift gears to the other major category, pigmented birthmarks.
These are the marks that get their color not from blood vessels, but from the skin's pigment cells, the melanocytes.
Correct. The sources explain that these birthmarks are made up of a cluster or overgrowth of melanocyte cells. These are the cells responsible for producing melanin, the pigment that gives your skin, hair, and eyes their color. Because these cells are clustered together, or there are more of them in one spot, that specific area of skin has more pigment than the surrounding skin.
And their color spectrum is different, ranging from brown to black or even bluish sometimes.
Exactly. They're not red because they don't involve extra blood vessels. They're colored because of the pigment itself. The first type our sources mention here is something most people are familiar with, pigmented nevi, which is the medical term for what we commonly call moles.
Moles are considered a type of birthmark if they're there at birth or develop early. I always thought of them as just moles.
Yes, particularly if they are present at birth or show up shortly after. Moles can appear as raised growths or flat spots, and their color can range widely, from light tan to brown to black, sometimes even the same color as your natural skin tone, but with a different texture. They can be tiny or quite large.
They can show up anywhere, and unlike many vascular marks, moles generally stick around for life. They don't usually fade away.
That's right, they're permanent residents on your skin. Now, within the category of moles, the sources specifically call out congenital nevi.
These are the moles that are literally present at birth. Congenital meaning from birth.
Correct. The sources estimate that about 1 in 100 people are born with 1 or more moles. So fairly common, too.
And this is where there can be a medical concern, isn't it, with these congenital ones?
Yes, this is the most significant point about congenital nevi. The sources clearly state that they have a slightly increased risk of developing into skin cancer, specifically melanoma, compared to moles that appear later in life.
Slightly increased? Is it a big risk?
The degree of risk, according to the sources, depends significantly on their size. Larger congenital nevi, generally defined as greater than 20 centimeters across, which is pretty big,
Yeah, that's large.
have a greater risk of malignancy than smaller ones. The risk for small or medium ones is still considered quite low, but it's not zero.
That's a critical takeaway. So the sources strongly recommend that all congenital nevi should be examined by a healthcare provider, and it's especially important to seek medical attention if any changes are noticed in a congenital mole, such as changes in size, shape, color, or texture. Monitoring is crucial.
Absolutely. Monitoring is key throughout life. Next up in the pigmented category are café-au-lait spots.
These have that lovely name because they look like coffee with milk.
Precisely. The sources describe them as flat, light tan, or light brown spots, typically oval in shape, with well-defined borders, usually quite uniform in color.
They could be there at birth or pop up later, right? Like in the first few years.
Yes, they might be present at birth, but they can also develop during the first few years of life. And like congenital nevia, they are permanent and can even grow in number and size as a person ages.
So if someone has one of these spots, is that usually a concern? Just one or two?
The sources are quite clear on this distinction, and it's another major insight. One or even a couple of café-au-lait spots are usually not a cause for concern. They are common and benign. However, having multiple café-au-lait spots, especially if they meet specific size criteria, is a significant clinical finding that should prompt further investigation for an underlying condition.
Multiple spots. That's the key. And the sources link multiple calls, as they're often called, most frequently to neurofibromatosis type 1. NF1.
Yes, NF1 is the classic and most common disorder associated with having multiple café-au-lait spots. Our sources, particularly Stat Pearls, provide extensive detail on NF1. They note its prevalence is approximately 1 in 3,500 people, making it a relatively common genetic disorder. It affects males and females equally across all ethnic groups.
And what causes NF1? It's genetic.
According to the sources, it's caused by a mutation in the NF1 gene, which is a tumor suppressor gene located on chromosome 17. It follows an autosomal dominant pattern, meaning a person only needs one copy of the mutated gene from either parent to have the condition. About half the cases are inherited, and half arise spontaneously through a new mutation in someone with no family history.
So if a healthcare provider sees multiple CALMs, what other signs should they be looking for to suspect NF1? It's not just the spots, right?
Right. The sources provide specific diagnostic criteria for NF1 established by the National Institutes of Health. A diagnosis is made if a patient has at least 2 of these 7 criteria present. It's like putting together a puzzle, and the CALMs are often the first, most visible piece.
Okay, let's go through those key diagnostic puzzle pieces the sources list. What's the first one?
First, and often the initial clue, is 6 or more café-au-lait macule, cock limbs, that meet specific size thresholds. They must be greater than 5 millimeters in diameter before puberty or greater than 15 millimeters in diameter after puberty. So it's not just the number, but the size that counts.
That size detail is really precise and important for doctors. 5 millimeter prepubertal, 15 millimeter postpubertal.
It is. Second, the presence of nerve tumors called neurofibromas. You need either one plexiform neurofibroma, which is a large, often complex, diffuse type of nerve tumor that can involve multiple nerve branches, or 2 or more neurofibromas of any type. These often appear as soft bumps on or under the skin.
Third, freckling, but not just any freckling. Specific locations.
Exactly. Specifically, freckling found in unusual places where the sun doesn't typically shine, like the armpit axillary or the groin inguinal region. The sources describe this, known as crow's sign, as being highly characteristic or pathognomonic for NF1.
Okay, pathognomonic means it strongly points to that specific condition. Fourth criterion.
An optic glioma. This is a tumor that grows on the optic nerve, which transmits visual information from the eye to the brain. It can potentially affect vision, though many are slow-growing and don't cause problems.
Fifth, 2 or more Lisch nodules. What are those?
These are small, benign, dome-shaped growths that occur in the iris, the colored part of the eye. They are usually harmless and don't affect vision, but are a strong indicator of NF1 when seen during an eye exam using a special light called a slit lamp. Very common in adults with NF1.
Sixth, a distinctive bony lesion.
This could be something like sphenoid dysplasia, which is an abnormality in a bone in the skull near the eye, or thinning and bowing of the cortex, the outer layer of long bones like the tibia, sometimes leading to fractures and a false joint formation, pseudoarthrosis, that's difficult to heal.
And finally, the 7th piece of the puzzle.
A clear family history. Having a first-degree relative, meaning a parent, sibling, or offspring who has already been diagnosed with NF1 based on these criteria, is also a diagnostic criterion.
So multiple CALMs are a major red flag, but a confirmed diagnosis of NF1 relies on finding a combination of these specific features, indicating a systemic condition affecting multiple parts of the body, not just the skin.
Precisely. It's a multi-system disorder. The sources also mention that if the CALMs and maybe neurofibromas are found predominantly in just one body region, it might indicate a variant called segmental NF1, caused by a mutation occurring after conception, affecting only certain body parts.
What are the potential complications or health issues associated with NF1, according to the sources? It sounds like it involves more than just skin marks and bumps.
NF1 can lead to a range of complications. Individuals with NF1 have increased risk of developing various tumors, including malignant, cancerous tumors of the nerve sheath, MPNSTs, optic gliomas, as we mentioned, certain brain tumors, and even certain types of leukemia.
Okay, so cancer risks is a
Ah,
factor.
yes. Beyond tumors, many children and adults with NF1 experience learning difficulties, problems with attention like ADHD, executive function challenges, and sometimes issues with motor skills or speech. Bone problems like scoliosis are also more common, so it can impact quality of life in many ways.
The sources also mention neurofibromatosis type 2, NF2, clarifying it's a different disorder, though related in name.
Yes, it's important not to confuse them. NF2 is caused by a mutation in a different gene, the NF2 gene, on chromosome 22, and it's also inherited in an autosomal dominant pattern. It's much less common than NF1, affecting about 1 in 40,000 births.
And the features are different. Less about skin spots.
Very different.
Yeah.
While some skin findings, like schwannomas, tumors similar to neurofibromas but from a different cell type, can occur, the hallmark clinical features of NF2 are bilateral vestibular schwannomas. These are tumors that grow on the nerves leading from the inner ear to the brain, affecting hearing and balance, typically on both sides.
Bilateral meaning both sides. That sounds very specific.
It is. NF2 can also involve cataracts, clouding of the eye lens, often at a young age, and other types of brain and spinal cord tumors like meningiomas and ependymomas. Calms are not a typical feature of NF2.
So symptoms like progressive hearing loss, ringing in the ears, tinnitus, balance problems, and dizziness are characteristic of NF2.
Exactly. The sources also link multiple calms, though usually in conjunction with other findings, to other rare genetic syndromes besides NF1.
Like McCune-Albright syndrome.
Yes. The sources describe this as a rare genetic condition caused by a mutation in the GNAS gene, occurring sporadically, not usually inherited. The classical presentation is a triad of features. Cafe-au-lait spots,
What kind of spots?
often large and with jagged irregular borders, sometimes described as looking like the coast of Maine, in contrast to the smoother coast of California borders more typically seen in NF1, though this distinction isn't absolute.
Okay.
The other features are fibrous dysplasia, abnormal, weakened bone growth that can lead to fractures or deformity, and endocrine problems, most classically precocious puberty, very early onset of sexual development, but also potentially thyroid issues, excess cortisol, or rickets.
Then there's Legis syndrome, sometimes called NF1-like syndrome.
This one is particularly interesting because it can look very similar to NF1 initially, especially in young children. Patients with Legis syndrome also have multiple calms, often axillary freckling, and can have a larger head size, macrocephaly, sometimes lipomas, benign fatty tumors, and learning disabilities, occasionally with facial features resembling Noonan syndrome.
But what's the crucial difference between Legis and NF1 according to the sources? Why isn't it just NF1?
The sources highlight that patients with Legis syndrome do not develop the neurofibromas, neither cutaneous nor plexiform, or the cranial nervous system tumors like optic gliomas or Lisch nodules that are characteristic of NF1. It's caused by a mutation in a different gene, the SPAD1 gene. The sources note that about 1 to 2% of individuals who initially seem to meet the criteria for NF1 might actually have Legis syndrome upon genetic testing.
That detail shows how complex the genetics can be. Even a similar-looking pattern of columns can point to different underlying conditions requiring different management and surveillance.
Absolutely. Genetic diagnosis is becoming increasingly important. The sources also briefly mention other syndromes associated with calms, like Watson syndrome, autosomal dominant, characterized by calms, pulmonic stenosis, a heart valve issue, intellectual disability and short stature, and Noonan syndrome with multiple lentogenes, formerly known as Leopard syndrome.
Leopard is another acronym from the sources. What does that stand for again?
Yes, and it describes its features. Lentogenes, multiple small, dark pigmented spots, similar to freckles but distinct. Electrocardiogram conduction defects, heart rhythm issues. Ocular hypertelorism, widely spaced eyes. Pulmonary stenosis, narrowing of the heart valve leading to the lungs. Abnormal genitals, retardation of growth, and sensorineural deafness, hearing loss. Calms can also be seen sometimes.
So finding multiple calms, especially if they have that distinct irregular border pattern mentioned by one source, or if other features are present, should prompt doctors to consider this whole spectrum of potential associated conditions.
Precisely. And the sources provide an even broader list of other conditions where birthmarks, including calms or other types like dermal melanocytosis, can be a feature, such as tuberous sclerosis complex, which has its own characteristic skin findings but can sometimes have calms, Fanconi anemia, Bloom syndrome, Silver-Russell syndrome, Nevus sebaceous syndrome, linked to a specific type of waxy, yellowish birthmark present at birth, often on the scalp, which has its own small risk of later malignancy. And as we mentioned, Sturge-Weber and Klippel-Trenaunay syndromes, linked to port wine stains.
Okay, let's shift to another type of pigmented mark the sources cover, dermal melanocytosis, which used to be called Mongolian spots.
Yes, the terminology has shifted to be more descriptive and less tied to specific populations, though the features remain the same. These usually appear as flat, bluish-gray or sometimes greenish-blue patches, often looking quite similar to bruises.
Bruise-like, okay. Where do they usually show up?
The sources say they are most often seen on the buttocks and/or lower back, but can sometimes appear on the trunk or arms. They typically have poorly defined edges and can vary in size, often around 2 to 8 centimeters wide.
And who gets these most often?
They are far more common in individuals with darker skin tones. The sources list children of Asian, American Indian, African, Hispanic, and Southern European descent as having the highest prevalence. In some Asian populations, for instance, the rate is extremely high, like over 80%.
That happens to them over time. Do they stay blue?
No. The good news is they usually fade significantly, often completely, by the time a child reaches school age, and they don't require any treatment.
Are they harmful?
The sources are clear that they are entirely harmless, they are not cancerous, nor are they indicative of any underlying disease. The blue color comes from melanocytes that got trapped in a deeper layer of the skin, the dermis, during development, rather than migrating all the way to the top layer, epidermis.
But because they look like bruises.
Yes, that's the main point of potential confusion. They can sometimes be mistaken for bruises, especially by people unfamiliar with them. Unlike bruises, however, they don't change color rapidly or disappear within days or weeks. The sources also note they are sometimes confused with skin findings over spina bifida occulta, a mild form of spinal cord defect, but those related marks are typically red vascular spots, not blue pigmented ones.
So important to recognize them for what they are. Harmless pigmentation.
Exactly. The sources also add a general note about pigmented birthmarks. Like regular moles, they might increase slightly in size as a person grows, and their color can sometimes change, perhaps darkening slightly after sun exposure or during periods of hormonal change like pregnancy. They can occasionally become itchy or might bleed if accidentally injured, just like any other part of the skin.
And the main potential complications for pigmented marks are psychological impact if they're prominent, and that increased risk of skin cancer we discussed, specifically for congenital NAVA.
Right. Those are the key concerns highlighted.
So bringing this back to you, the listener, this is why it's not just about cosmetic appearance. This potential link between certain birthmarks, especially multiple café-au-lait spots or large congenital nevi, and these underlying genetic syndromes or cancer risk is exactly why getting significant or unusual birthmarks checked out by a healthcare provider is so incredibly important for your health or your child's health. It's not about vanity. It's about identifying potential medical issues early, which can make a huge difference in long-term health outcomes.
That's the crucial take-home message from this section of the sources. They also briefly touch on the pathophysiology, the actual biological mechanisms, mentioning things like increased melanin production or clustering of melanocytes and pigmented marks, and potential roles of abnormal growth factors like stem cell factor or hepatocyte growth factor, or mutations in pathways like the VGFT2 pathways for haemangiomas. For NF1-associated CALMs, for example, the sources mention that looking at skin under a microscope, histopathology, can show an increase in melanin in the bottom layer of the epidermis and sometimes unusually large pigment packets called giant melanosomes within the melanocytes. But the exact why for most birthmarks forming is still largely unknown.
Right, the ultimate cause remains a bit of a mystery for many types. Okay, we've covered the types and the serious why it matters connections. Now, how do doctors actually figure out what kind of birthmark it is? And crucially, when is the right time for you to seek help from a healthcare provider?
The sources explain that the initial diagnosis of a typical birthmark is usually quite straightforward. A healthcare provider, a pediatrician, dermatologist, or primary care physician can often diagnose it simply with a physical examination by visually inspecting and looking closely at the mark on the skin. They'll note its color, shape, size, texture, and location.
Just by looking.
Often, yes, for the common types. Their appearance is usually characteristic enough, but what if the mark is deep, or they suspect something more? If a birthmark is located deep within the skin, like a suspected cavernous haemangioma, or if it's a vascular type where they suspect internal involvement, like with multiple haemangiomas or PACE syndrome, imaging tests can be very helpful to confirm the diagnosis or assess the extent. The sources mention using techniques like MRI, magnetic resonance imaging, ultrasound, or CT scans for this purpose. MRI is often preferred for soft tissue detail.
And if there's concern about skin cancer, like with a changing mole, a congenital nevus that looks different.
In those cases where a birthmark, especially a mole, changes in a suspicious way, maybe it gets darker, grows rapidly, develops an irregular border, starts bleeding, or just looks different from other moles, the ugly duckling sign, a skin biopsy might be necessary. This involves taking a small sample of the mark, or sometimes removing the whole thing if it's small, to be examined under a microscope by a pathologist to check for cancerous cells.
Linking back to our earlier discussion, the sources strongly emphasize the need to evaluate for associated syndromes, particularly when we're talking about café-au-lait spots.
Absolutely. This is a core part of the diagnostic process if multiple culms are present, especially in children. As we discussed, having 6 or more culms meeting those specific size criteria is a major trigger for this evaluation.
What does that syndrome evaluation involve? More than just looking at the spots, right?
Definitely. The sources lay out a comprehensive approach. It starts with a very thorough physical examination by a clinician experienced in these conditions, often a geneticist or a specialized dermatologist or neurologist. This includes a detailed skin check, looking specifically for things like freckling in the armpit or groin, crow's sign, and palpating, feeling for the presence of neurofibromas, which can range from small soft bumps to larger, deeper masses.
An eye exam sounds important too, based on the NF1 criteria we talked about.
Crucial. An ophthalmological examination with a slit lamp is essential to check for Lisch nodules in the iris, for NF1, and also to look for any signs of an optic glioma affecting the optic nerve. For NF2 suspects, checking for cataracts is also key.
And they look at development too, how the child is doing overall.
Yes, the sources highlight the importance of taking a detailed developmental history and assessing a child's progress in school, looking for any learning disabilities, speech delays, motor skill issues, or attention problems that might be associated with syndromes like NF1 or Legius syndrome.
And ultimately, genetic testing can confirm the suspected syndrome.
It can, if clinical findings strongly suggest a specific genetic syndrome like NF1, NF2, Legius, etc. Genetic testing can be performed on a blood or saliva sample to look for the characteristic gene mutation, providing a definitive diagnosis. And if a syndrome is confirmed, the sources recommend evaluating other first-degree family members as well, given the often inherited nature of these conditions, even if they don't show obvious signs.
For NF2 specifically, the sources mentioned a particular type of imaging for diagnosis.
Yes, if NF2 is suspected based on symptoms like hearing loss or a family history, a brain MRI, often with contrast, is the key test used to visualize the vestibular schwannomas, tumors on the hearing balance nerves, and other potential tumors in the brain and spinal cord.
The StatPearl source also includes a list of other conditions that can sometimes look like birthmarks but aren't, called the differential diagnosis. Things like Addison's disease or Becker-Nevis.
Right, that's a list for clinicians to consider things like widespread skin darkening due to hormonal issues, Addison's disease, hemochromatosis, other types of non-congenital moles or pigmented patches like Becker-Nevis, Nevis spilus, lentigo, skin reactions, post-inflammatory hyperpigmentation, phytophotodermatitis, or even other types of skin growths, urticaria pigmentosa, mastocytoma. It just reinforces that making an accurate diagnosis requires experience and sometimes additional tests to rule out other possibilities that might mimic a birthmark.
So for you, the listener, the really actionable information here is knowing when to seek help. The sources give some clear guidance on when you should consult a healthcare provider about a birthmark. This seems really important.
This is probably the most important practical takeaway from this section. You should definitely consult a doctor if you notice any significant changes to an existing birthmark, particularly a mole.
What kinds of changes should trigger a visit? We mentioned the ABCDEs for moles earlier.
Right, so changes in asymmetry, one half doesn't match the other. Border, irregular, scalloped, or poorly defined edges. Color, variations of tan, brown, black, sometimes white, red, or blue within the same mole. Diameter, larger than 6 millimeters, about the size of a pencil eraser, though melanomas can be smaller. Or evolving, any change in size, shape, color, elevation, or another trait, or any new symptom like bleeding, itching, or crusting.
Okay, those are the melanoma warning signs for moles. What about other changes or reasons to see a doctor?
Also, if you develop new pigmented marks on your skin as an adult, it's a good idea to get them checked, especially if they appear suddenly or look different from your other moles.
And what if a birthmark starts causing physical discomfort, even if it doesn't look like it's changing?
Yes. If a birthmark becomes persistently painful, starts to bleed without significant injury, feels constantly itchy, or shows any signs of infection like increasing redness, swelling, warmth, or pus, you should definitely see a doctor.
For parents of a child with a birthmark, the sources have specific advice.
They recommend having a healthcare provider examine a child's birthmark when it first appears, or soon after. This helps the doctor determine the type and decide if monitoring or treatment might be needed later on.
And call the doctor if.
And crucially, they say parents should definitely call the doctor if a child's birthmark ever bleeds and doesn't stop easily with pressure, causes pain, is significantly itchy, or looks infected. The sources even provide practical advice for bleeding. Clean the area gently with soap and water, and apply firm, direct pressure with a clean cloth for several minutes. If the bleeding doesn't stop, seek medical attention.
They also note that with haemangiomas, sometimes open sores, ulcerations can form, and these can get infected and be quite painful.
Right, that's a common complication needing treatment. And while most pigmented birthmarks don't cause physical problems beyond cosmetics or occasional irritation, the sources reiterate that moles, especially congenital nevi, should be checked periodically throughout life for any changes because of that potential, albeit often small, increased risk of melanoma.
And tying back to the potential syndromes, the sources list specific reasons why parents should seek an evaluation for their child related to pigmented marks. These seem like clear action points.
Yes, seek evaluation if a child has. 1, an undiagnosed pigmented lesion that looks unusual or worrying. 2, more than 6 café-au-lait spots, remembering those size criteria 5 mm prepubertal, 15 mm postpubertal. 3, calms and firm nodules or bumps felt on the skin, which could be neurofibromas. 4, calms, and it also shows signs of a learning disability, language delay, or other developmental delay. And or 5, if there are family members with multiple calms or a known diagnosis of NF1.
Those are key indicators that a deeper look is needed, potentially involving specialists.
Exactly. And for individuals diagnosed with syndromes like NF1 or NF2, it sounds like there's ongoing medical management required. It's not a one-time diagnosis. Absolutely. The sources recommend regular follow-up appointments, often involving annual history and physical exams, detailed skin checks, ophthalmology exams to monitor for eye involvement like optic glioma or loose nodules for NF1 or cataracts, NF2, and audiology exams, hearing tests, particularly for NF2. For NF2, annual brain MRI scans are recommended starting around age 10 or 12 to screen for vestibular schwannomas and other tumors, as early detection can influence treatment options. This underscores that for associated syndromes, the birthmark is just the initial sign of a condition that requires proactive, long-term, multidisciplinary care.
So the diagnostic process can range from a quick look to extensive testing, and being aware of key changes and signs is vital for knowing when to seek professional help.
It really empowers you.
It empowers you to be proactive about your health or your child's health.
Absolutely.
Now, let's talk about what happens if a birthmark isn't just monitored, but actually treated. What are the management and treatment options the sources discuss?
The sources begin by reinforcing a point we made earlier. Most birthmarks, particularly the common ones like salmon patches and many strawberry hemangiomas, don't actually require any medical treatment. They are typically harmless and, for many people, are simply part of their unique appearance.
And some, like the salmon patches and strawberry hemangiomas, will fade on their own anyway, so watchful waiting is often the best approach.
Exactly. However, other types like port wine stains or congenital nevi are permanent features unless specific treatment is pursued.
So when is treatment considered? What are the reasons someone might choose or need to treat a birthmark?
The sources identify a few main reasons. One is cosmetic if an individual is significantly bothered by how a birthmark looks, especially if it's large or on a prominent area like the face, and it's affecting their self-esteem or social interactions.
Okay, cosmetic reasons are valid.
Yes. Another reason is if there's a higher medical risk associated with the birthmark, most notably the increased risk of skin cancer with certain types of congenital nevi, especially the large ones. Removal might be recommended prophylactically in some cases.
Right, prevention.
And a very important reason, particularly for infants with hemangiomas, is if the birthmark is causing functional problems, meaning its size or location is interfering with vital bodily functions like sight, feeding, breathing, or even hearing or movement if it's near an ear canal or joint. Ulceration and bleeding are also reasons for treatment.
The sources add a crucial caution here. A big don't.
Yes, a very important one. You should never attempt to remove a birthmark at home using any creams, home remedies, or makeshift methods you might find online. These are not effective, can cause significant harm like scarring, infection, or discoloration, and could potentially delay necessary medical evaluation if there's an underlying issue. Always consult a healthcare provider.
Good advice. They also note that for cosmetic treatment of childhood birthmarks, waiting might be better sometimes.
Yes, it's often recommended to wait until the child is older, maybe after age 6 or even into adolescence, unless the birthmark is functionally impacting them or causing significant psychosocial distress. This allows time for natural changes, like fading hemangiomas, and for the child to be part of the decision-making process if it's purely cosmetic. Functional issues, though, need earlier intervention.
Makes sense. So what are the professional treatment options that healthcare providers might recommend, according to the sources?
A healthcare provider can discuss the best approach based on the specific type of birthmark, its location, size, the patient's age, and whether it's causing problems. The sources list several established methods.
First, laser therapy. This seems quite common now.
It is a very common treatment, especially for vascular birthmarks like port wine stains, but can also be used for some pigmented marks and residual redness from hemangiomas. The sources explain that laser treatment works by using focused beams of light.
How does light get rid of red or brown marks?
Well, for red birthmarks, specific wavelengths of laser light are selectively absorbed by the hemoglobin in the blood within the abnormal blood vessels. This converts the light energy into heat, which then damages or destroys those vessels, causing them to shrink or collapse without significantly harming the surrounding skin. For pigmented marks, different lasers target the melanin pigment, breaking it up so the body can clear it away.
What kinds of vascular marks does it help with most?
It's most widely used and effective for lightening red birthmarks like port wine stains. The sources note that starting laser treatment early, ideally in infancy when the skin is thinner and the vessels smaller, often yields the best results for port wine stains, and marks on the head and neck tend to respond better than those on the limbs.
Can it be used for hemangiomas too?
Yes, laser can be used to treat the superficial component of some hemangiomas, reduce the tiny visible blood vessels, telangiectasia, that might remain after a hemangioma has naturally resolved, or sometimes to help heal painful ulcers on hemangiomas that aren't responding to other care. For specific airway hemangiomas, like in the windpipe, subglottic hemangiomas, a different type of laser, like a diode laser, is sometimes used by specialists.
And pigmented marks like café-au-lait spots.
Early studies showed some potential for lasers to treat pigmented marks like café-au-lait spots or certain congenital navy, but the sources suggest results can be variable, complete removal isn't always achieved, and sometimes the pigment can return. So it's used, but maybe less predictably than for vascular marks.
What kind of results can someone expect with laser for, say, a port wine stain? And can the mark come back?
The sources say that for port wine stains, multiple treatment sessions, often 6 to 10 or even more, spaced several weeks or months apart, are typically needed. While the mark usually gets significantly lighter, it may not disappear entirely. For some treated marks, the redness or color can return over time, possibly requiring maintenance treatments years later. Laser can provide permanent reduction in vessel size or pigment, but it's not always a complete one-time cure.
And side effects from laser. Is it painful?
It can be uncomfortable, often described as feeling like a rubber band snapping against the skin. Topical numbing creams or cooling devices are often used. Common side effects right after treatment are usually temporary and include redness, swelling, bruising, irritation, or peeling in the treated area, often lasting about 24 hours to a few days.
Are there more serious risks?
Yes, though less common. Potential risks include hyperpigmentation, lighter patches, hyperpigmentation, darker patches, which can be temporary or permanent and is more common in darker skin types, blistering, crusting, and very rarely scarring or incomplete clearance of the birthmark. The sources mention preparing for treatment might involve avoiding sun exposure and certain medications beforehand, and aftercare involves keeping the area clean, moisturized, and strictly protected from the sun to minimize side effects and optimize results. Healing typically takes about a week or two, depending on the intensity. Okay, the next treatment option is surgery.
This involves physically removing the birthmark, cutting it out.
Yes, using a scalpel. This can be done in different ways. A shave excision removes just the top layers of the mark, which might be suitable for some raised moles. A full thickness excision cuts out the entire mark down to the fatty layer, and the skin is then closed with stitches. This is often the choice for removing congenital nevi to check for cancer or for cosmetic reasons, or sometimes for removing residual tissue after a hemangioma has shrunk.
Where is this usually done?
It's often done in a doctor's office or a minor surgery suite using local anesthesia to numb the area. However, for very large birthmarks, or if multiple areas need treatment or in young children, general anesthesia in a hospital operating room might be necessary.
Surgery sounds like it offers permanent removal, which laser might not always achieve.
The sources state that surgical excision provides permanent removal of the birthmark from that location. That's the main advantage. The main disadvantage or risk mentioned with surgery is scarring. While surgeons use techniques to minimize scarring, like placing incisions along natural skin lines, a scar is an unavoidable outcome of cutting the skin.
Are there other risks?
Yes, as with any surgical procedure, there's a risk of bleeding, developing an infection in the surgical site, and potential issues with wound healing.
Aftercare is usually straightforward.
Yes, typically minimal downtime, especially for smaller excisions. It involves keeping the incision clean and dry, possibly applying antibiotic ointment, and avoiding strenuous activity that could strain the stitches while it heals. Stitches are usually removed after a week or two, depending on the location. Moving on to medication, which is a crucial treatment, particularly for certain types of vascular birthmarks like rapidly growing infantile hemangiomas.
These medications work by shrinking the birthmark from within. They don't remove it, but reduce it.
Exactly. They target the biological processes driving the growth of the hemangioma, mainly the blood vessels themselves or the factors that make them grow. The sources specifically highlight the use of beta blockers, most commonly propranolol, taken orally as a liquid or tablet.
I thought beta blockers were usually for heart conditions or blood pressure. How did they end up being used for birthmarks?
They are, and that's how their effectiveness was discovered. The sources explain it was somewhat serendipitous. Doctors noticed that infants taking propranolol for unrelated heart issues saw their hemangiomas shrink dramatically. This led to studies confirming its effectiveness, and now it's considered a first-line treatment for problematic infantile hemangiomas.
That's amazing. How do they work for hemangiomas? What's the mechanism?
The exact mechanism is still being fully elucidated, but the sources say it's believed beta blockers work in a few ways. One, they cause vasoconstriction, meaning they narrow the blood vessels within the hemangioma, reducing blood flow. Two, they seem to decrease the levels of certain growth factors like VEGF, vascular endothelial growth factor, that promote blood vessel formation. And three, they may trigger apoptosis, which is programmed cell death in the endothelial cells that line the blood vessels of the hemangioma. The combined effect is shrinkage of the lesion.
When is propranolol most effective?
It's most effective during the rapid proliferative phase of infantile hemangiomas, which typically occurs in the first 5-6 months of life and ends around age 1. Starting treatment early during this growth phase yields the best results. It's less effective once the hemangioma has stopped growing or started shrinking on its own.
The sources mention that relatively high doses are needed for this treatment compared to cardiac uses.
Yes, doses around 2 to 3 milligrams per kilogram of body weight per day, usually divided into 2 or 3 doses, are typically required. Because it's a heart medication being used at these doses in infants, the sources stress the need for careful patient selection, ruling out certain heart or breathing issues, and close medical monitoring, especially when starting treatment. This might involve initial in-hospital monitoring of heart rate and blood pressure or regular checkups with a cardiologist.
What are the potential side effects of propranolol in infants that parents should watch for?
The sources list potential side effects including bradycardia, slowed heart rate, hypotension, low blood pressure, hypoglycemia, low blood sugar, especially if the baby isn't feeding well, bronchospasm, wheezing, or difficulty breathing, particularly in susceptible infants, constipation or diarrhea, cool extremities, and sleep disturbances like difficulty sleeping or nightmares. Parents are advised to contact the doctor immediately if their child experiences any concerning side effects.
And how long is this treatment needed? Is it a short course?
No, it's typically a long course. Treatment is usually continued until around 12 to 18 months of age, well past the end of the typical growth phase, to minimize the risk of the hemangioma regrowing after the medication is stopped. The sources recommend tapering the dose down gradually at the end of treatment rather than stopping abruptly. The results achieved with propranolol are usually permanent once treatment is completed. Corticosteroids are another class of medication mentioned for hemangiomas, though perhaps used less often now as a first choice since propranolol became available.
These can be given as injections directly into the hemangioma or taken orally as pills or liquid.
Yes. The sources state that corticosteroids can also be effective in shrinking certain hemangiomas or halting their rapid growth, particularly during the proliferative phase. Oral doses, like prednisone or prednisolone, are typically in the range of 1 to 3 milligrams per kilogram per day. One source noted that oral corticosteroids have a high response rate, around 84% in a meta-analysis, but they come with more side effects than propranolol.
What are the side effects of steroids that make them less favored now?
Common side effects with systemic oral steroids can include irritability, increased appetite and weight gain, opportunistic infections like oral thrush, candida, irritation of the stomach lining, and a characteristic puffy face appearance called Cushingoid facies. More rare but serious possible side effects include steroid myopathy, muscle weakness, hypertension, high blood pressure. So blood pressure monitoring is mandatory during treatment and suppression of the adrenal glands. Steroids can also temporarily suppress growth, although the sources say catch-up growth usually occurs after the medication is stopped.
And they affect the immune system.
Yes, the doses used are immunosuppressive, meaning they can lower the body's ability to fight infection, so live vaccinations like MMR or chickenpox should be avoided during treatment, and there's an increased risk of infections. Because of the side effect profile, propranolol is generally preferred now.
What about steroid injections?
The sources also mention that sometimes injecting steroids directly into the birthmark, intralesional injections, can be sufficient for smaller, localized, or thicker hemangiomas, potentially reducing the systemic side effects associated with oral steroids. This might be used alone or in combination with other therapies. The sources briefly mention a few other medications used in very specific, complex, or life-threatening cases where other treatments haven't worked or aren't appropriate. These include interferon alpha-12, IF-RED.
Interferon. Isn't that used for other conditions?
It is, but it can affect blood vessel growth too. However, it's generally considered a last resort for hemangiomas in the first year of life due to a rare but serious risk of neurological side effects like spastic diplegia, a type of muscle stiffness similar to cerebral palsy. The risk seems lower in older children.
Okay, definitely sounds like a last resort.
Then there's vincristine, a chemotherapy agent. It's been trialed and proven effective in some difficult hemangioma cases, like large liver hemangiomas causing heart failure, by causing apoptosis, cell death, in the rapidly dividing endothelial cells. But it requires administration via a central line and management by specialists like a pediatric oncologist or hematologist due to potential side effects.
And thalidomide. That has a difficult history.
It does, but it's known to inhibit blood vessel growth factors like VEGF and BFGF. One source mentioned it being used successfully in a single reported case for a life-threatening intracranial hemangioma inside the brain when other treatments failed, but its use is highly restricted due to its history.
The sources also list cryotherapy, freezing, and cortisone injections, which we just discussed as intralesional steroids, as other methods sometimes used for birthmark removal or treatment.
Yes, adding to the array of medical procedures that can be employed depending on the specific situation, cryotherapy might be used for very small, superficial lesions.
Thinking about the practical side, the sources provide some insight into the cost of treatment. I mean, it's expensive, right?
They do. The cost can vary significantly depending on the type of treatment. Laser resurfacing, for example, can range from $1,000 to $3,000 per session, and as we noted, multiple sessions are often necessary, so the total cost can add up quickly. Surgical removal, like a shave or simple excision, might range from $100 to $500 or much more. Highly variable based on size, location, complexity, anesthesia needs, and facility fees.
And insurance coverage is a big question for many people. Will insurance pay for birthmark removal?
It absolutely is. The sources generally state that insurance typically does not cover birthmark removal if the primary reason is purely cosmetic. Insurers often classify that as non-medically necessary.
Are there exceptions?
Yes, there may be exceptions made, particularly for large, prominent marks in highly visible areas like the face, where the psychological impact might be documented as significant, or if the mark carries a clear medical risk like potential malignancy, for example, large congenital nevi, or is causing functional impairment like a hemangioma blocking vision. Getting coverage often requires thorough documentation from the doctor explaining the medical necessity.
Given that many common birthmarks in children can change or fade, the sources suggest that waiting until adolescence or adulthood might be the best approach for deciding on cosmetic treatment.
Yes, that allows time for natural changes and for the individual to be mature enough to participate in the decision and understand the risks and benefits, especially if the motivation is purely cosmetic.
What about medication coverage, like propranolol for hemangiomas?
Medications used for vascular birthmarks like haemangiomas, when deemed medically necessary due to functional impairment, risk of scarring, ulceration, or other complications, are generally more likely to be covered by insurance compared to cosmetic procedures, though pre-authorization might still be required.
And downtime after treatment. How much recovery is needed?
That also varies. Surgery usually has relatively little downtime for small excisions, focusing on wound care and avoiding strain for maybe a week or two. Larger surgeries requiring general anesthesia will have more recovery. Laser therapy has that initial 24-hour period of redness swelling, with the treated area typically healing within a week, but sun avoidance is key for longer. Medication treatment, especially with oral beta blockers or steroids, is a long-term commitment over many months, but doesn't usually involve significant downtime in the typical sense, though regular monitoring visits are needed.
So treatment options are diverse, tailored to the specific birthmark and situation, and involve considering the medical need, potential risks and benefits, cost, insurance hurdles, and recovery.
It's rarely a one-size-fits-all approach. It requires careful discussion between the patient or parents and the healthcare provider.
Finally, and perhaps most importantly, our sources provide significant insight into the human side living with a birthmark. This goes beyond the medical charts and procedures and looks at the personal experience.
This section of the sources is incredibly important because it highlights that living with a visible birthmark isn't just about the physical mark itself. It can have a very real and often profound psychological and social impact on individuals and their families.
The sources are quite direct about the challenges people can face. It's not always easy.
They are. Birthmarks, especially those that are large, uniquely shaped, or on visible areas like the face or hands, can be an inherent source of stigma and discrimination in everyday life. The sources describe how people living with these visible differences may experience social anxiety and significant discomfort when interacting with others, constantly worrying about how strangers will perceive them and react to their appearance.
What form does this stigma often take? What do people actually experience?
The sources detail common experiences. Persistent staring, which can feel intrusive and objectifying, hurtful teasing and bullying, especially during childhood and adolescence, whispers and pointing, and sadly, unsolicited and often insensitive comments or advice from others, even complete strangers.
Unsolicited advice, like have you tried covering that up?
Exactly, or suggesting miracle cures or asking intrusive questions about what happened. The sources note that this kind of treatment is very common and, understandably, can significantly impact a person's self-worth, body image, and overall emotional well-being. It can foster feelings of being different, unattractive, flawed, or like there's something wrong with them that needs to be fixed.
That kind of constant negative feedback must be incredibly damaging to one's confidence.
It can be. The sources suggest these feelings can lead to reduced self-confidence and even affect motivation in various areas of life, such as pursuing educational goals, career aspirations, or forming intimate personal relationships. As a coping mechanism, some individuals may feel pressured to use techniques to hide their marks, like heavy makeup or specific clothing styles, or feel compelled to seek medical treatment solely to conform and feel more accepted by society, even if the mark is medically harmless.
And these negative experiences can start very early in life. You mentioned childhood teasing.
Yes. Sadly, teasing and bullying are common experiences for children with visible birthmarks. The sources mention that this can lead to various coping strategies. Some children might develop humor or sarcasm to deflect comments, while others might become withdrawn, shy, or avoid social situations where they anticipate negative reactions.
The sources also point out that past advice given to families might have inadvertently made things worse. Something about hiding the marks.
They note that historically, in some places, the advice given to parents of children with birthmarks was sometimes to try and hide the mark as much as possible with clothes or makeup. The sources argue that while perhaps well-intentioned, aiming to protect the child from teasing, this advice actually perpetuated the idea that the birthmark was something undesirable or shameful that needed to be concealed. This could lead to increased distress and anxiety for the child about their own body and appearance.
And it's not just the individual with the birthmark who is affected. The sources highlight the impact on the family as well, particularly parents.
Absolutely. Parents especially can carry a significant emotional burden. They may experience feelings of sadness, worry, anxiety, or even guilt when their child is born with a visible birthmark, sometimes irrationally blaming themselves or wondering what they did wrong during pregnancy.
What seems to cause a lot of distress for parents are the comments they receive from other people about their child.
This is detailed quite powerfully in one source. drawing from patient group experiences, like the CMTC-OVM material. It emphasizes that the vast majority of comments directed at parents about their child's birthmark tend to be negative or ignorant, and shockingly, very often come from complete strangers in public places.
Strangers commenting on your child.
Yes, people may simply be uneducated about birthmarks and their appearance, leading to unintentionally hurtful remarks like, "What's wrong with your baby?" But the source notes that some strangers have gone as far as to assume the child is being abused or neglected due to the appearance of the mark, mistaking a port wine stain for a bruise perhaps, or express outright surprise and disgust, labeling the child as abnormal or undesirable.
That level of insensitivity is just awful to hear, imagining strangers saying that about your child.
It is, and the sources underline that these comments cause immense distress and place a large emotional burden on parents, adding to the challenges they already face in navigating their child's condition and well-being.
The sources also point out that sometimes even healthcare professionals, despite their medical knowledge, can unintentionally perpetuate stigma. How so?
They might make assumptions. For example, they might automatically assume that a patient or family presenting with a birthmark is there seeking treatment or removal because the mark is obviously a problem or a defect, rather than first exploring the patient's or family's feelings, offering sensitive support, providing unbiased information about natural history and options, including not treating, and acknowledging the potential social challenges. This assumption that treatment is the default goal can inadvertently reinforce the societal message that the birthmark should be a source of shame or dissatisfaction.
So there's a real need for greater awareness and sensitivity, not just in the general public, but maybe within the medical community too.
The sources definitely suggest this. One study mentioned proposes that potentially hurtful behaviors like staring might not always stem from malicious intent, but could sometimes come from simple curiosity, lack of awareness, or uncertainty about how to react or what to say around someone with a visible difference. This powerfully highlights the need for public education about birthmarks and, more broadly, greater exposure and positive interaction with people who have visible differences to normalize diversity and reduce misunderstanding and stigmatization.
And training is needed for healthcare professionals too, beyond just the medical facts.
Yes, the sources explicitly state that medical training shouldn't just cover the clinical diagnosis and treatment of birthmarks, but also equip healthcare providers to react sensitively to patients' and families' experiences, to ask open-ended questions about their concerns, which might be social, not medical, advise on coping strategies for social challenges, and be knowledgeable about available psychological support and community resources.
What kind of support is available for individuals or families struggling with the psychological impact, if someone is feeling anxious or depressed about their birthmark?
The sources recommend resources like cognitive behavioral therapy, CBT, and sometimes social skills training. CBT is a type of talk therapy that can be very helpful in teaching individuals how to identify and challenge negative thought patterns they might have about themselves or that stem from others' reactions, like assuming everyone is staring or judging them. It provides practical coping tools for managing anxiety and navigating difficult social situations.
Is CBT easy to access?
Access can vary depending on location and healthcare systems, but it's a well-established approach, sometimes available through online courses, support groups, or individual therapy sessions. Social skills training can also help people practice how to handle questions or comments about their birthmark assertively and confidently.
And connecting with others who have similar experiences sounds invaluable.
Well,
Support groups.
Absolutely. Patient advocacy groups and support organizations are described as vital resources. They offer a safe space, accurate information about specific conditions, statistics, treatment options, referrals to knowledgeable specialists, articles sharing personal stories and coping strategies, online forums for connection and peer support, and often organize conferences or events to bring people and families together.
That sense of community must make a huge difference.
It really can. Educating oneself about the birthmark and connecting with a supportive community is highlighted as empowering and can significantly ease feelings of anxiety, shame, and isolation. The sources specifically mention groups like the Birthmark Support Group in the UK and Changing Faces, also UK-based but with global reach, as examples of organizations providing this kind of support for people with visible differences. Finding reliable information and shared experiences can be incredibly validating.
It's clear from the sources that the psychosocial aspect of living with a birthmark is a huge and complex part of the experience, deserving of serious attention and support, alongside any medical considerations.
Absolutely. It's not just about treating the mark on the skin, but supporting the whole person living with it and their family too.
So, we've completed our deep dive into the world of birthmarks. We started by exploring their surprising variety, from the incredibly common, often fading salmon patch and strawberry hemangioma, to the permanent port wine stain and café-au-lait spot, and the rarer, more complex congenital types like RICH and NICH.
We touched on the persistent mystery of their exact initial causes for many types, but stressed the critical importance of recognizing when a birthmark isn't just a mark, but might be a signpost, a clue to an underlying medical condition or genetic syndrome, like the significant link between multiple café-au-lait spots and neurofibromatosis type 1, or certain vascular marks and syndromes like PHACE or Klippel-Trenaunay.
And we covered how they are medically evaluated, from a doctor's visual inspection to imaging like MRI or ultrasound, biopsies when cancer is a concern, and sometimes extensive genetic studies when syndromes are suspected. We also looked at the range of treatment options available when needed, from lasers and surgery to powerful medications like beta blockers and corticosteroids, each with their own mechanisms, effectiveness, risks, costs, and recovery times.
And finally, and maybe most impactfully, we heard from the sources about the very real emotional and social journey that living with a visible birthmark can be for both the individual and their family. We touched on the challenges of stigma, insensitive comments, the impact on self-esteem, and the vital importance of psychological support, community connection, and greater public awareness.
So, what does this all mean for you listening? The main takeaway from all these sources is that while the vast majority of birthmarks are indeed harmless cosmetic features, just part of what makes someone unique, having this knowledge is incredibly valuable. Knowing the different types, understanding the potential signs that warrant medical attention, particularly changes in appearance, or the presence of multiple marks meeting specific criteria, and being aware of the very real psychosocial impact is key. It empowers you to seek help when needed, and to approach the topic with greater understanding and empathy. Always consult a healthcare provider if you have any concerns or notice changes in a birthmark.
And you know, this deep dive into the medical and social aspects of birthmarks raises a broader question, doesn't it? Given how common birthmarks actually are, appearing on such a significant percentage of the population, and the significant emotional and social impact they can have, as described so clearly in our sources, perhaps the most crucial deep dive needed next is not just into the science of the marks themselves,
but into how we, as a society, perceive and react to all visible differences.
Exactly. How can we move beyond judging appearances? How can we foster a greater sense of understanding, empathy, and genuine acceptance for everyone, regardless of the unique features they carry on their skin, whether it's a birthmark, a scar, or any other variation?
What does this mean for how you might view or interact with someone with a birthmark in the future? Maybe moving from curiosity or uncertainty towards genuine understanding and seeing the person, not just the mark. Or perhaps how you might view or accept your own marks, recognizing them not as flaws, but simply as part of the incredible, varied tapestry of human appearance.
It's definitely something worth pondering.